things that I'd like for you to do, though.
Get your name real quick, sir.
Mike Breitbach from Strawberry Point, Iowa.
Thanks, Mr. Breitbach.
Thank you. One of the things that I'd like you to look at is you made a statement about that if I go to a new group plan with my employer, that there will be pre-existing conditions. In Iowa, as an employer, I know that's not true. We're not even allowed to ask medical questions on our health insurance applications as long as they sign up during the sign-up period that when they start their new job. So that's not true in Iowa. And
your experience is different than mine, because when we were trying to find replacement coverage, we had to provide data that was used as part of the pricing that was given to us by other insurance companies. But go ahead.
okay. Well, yeah, you have to do that if you're trying to replace insurance. Right. But as a new employee, they're not allowed to give you an exemption. So, and I don't know that came out from you.
No, if I left that impression, I apologize. That's not what I meant to say.
And right now, you said under the public option that the reimbursement to the doctors and hospitals would be something between where Medicare pays and where private insurance now pays.
Yes.
I don't know that that's a level playing field if the public option plan is going to be able to pay less than private insurance. If they can pay less, I don't know how that's playing on a level playing field.
Okay, well, let me address your concern. Let me address your first comment, though, okay? I am not somebody who looks over my shoulder and weighs how I'm voting based upon whether it's going to get me reelected. The beauty of the House of Representatives is I run every 2 years, and the people I represent in the 1st District decide whether I get to continue my job. And if they decide that they don't trust me and they want to send me home, I'm fine with that. Okay? Okay? That's a democracy, and I accept that. But to your point, let me just give you some figures. One of the 2 companies that are part of that 80% of the market share in Iowa is United Healthcare. Now, United Healthcare, on the last 5 years, has averaged $3 billion in profits, making them the most profitable company in America. Their CEO gets an annual salary of $14 million. He has $744 million in unexercised stock options. And recently, he was required to pay back $190 million in stock options because of practices that were found to be fraudulent by the SEC. Now, when you're talking about an unlevel playing field for private insurance companies, you have to look at what we've been getting from private insurance companies. Because what's happened in the insurance business is it's changed a lot since you and I were kids. Because it used to be most of these companies were mutual insurance companies owned by the policyholders. And then something happened. It was called the demutualization of the insurance business. And those mutual companies that used to care only about their policyholders now have to return dividends to their shareholders as stock insurance companies. And when the economy goes bad, it's harder to find profits to return. And what's happening is that the loading fee, the percentage of healthcare premiums that are actually paid for healthcare, has been decreasing as profits and administrative costs in private companies have gone up. So one of the things that we've done is we've said, if you're going to have a public option, you have to go out and build your own provider network. There were some people who want to make it tied directly to people who are currently providing Medicare. So if this hospital in Manchester and physicians are Medicare providers, they would have to participate in the public option. That's not in the House bill. The Secretary has to go out and negotiate to convince these providers that it's in their best interest to participate in the public option. And if they say, no, we don't want to do it, then they're going to have a hard time getting people into the plan unless they offer competitive rates. And how do we know that's true? When Medicare was first started, because of the concern expressed by many physicians about changing the way they were paid, they came up with a payment system that paid on average 75% of what the average cost for those procedures was. And they got a lot of physicians to come into the system. The Secretary is going to have to deal with those market realities in building a provider network, or the public option won't succeed. And in fact, the Congressional Budget Office has analyzed this bill predicts that by 2019, only 11 to 12 million people will choose the public option. Well, at the same time, they predict by 2016, there will be 11 to 12 million people in the exchange who didn't have insurance before. So that means at most, that will be the new people coming into the system, and some of them will go into the private exchange. So the net effect is going to be minimal over the first 10 years of the plan.
Thank you very much.